Parents, we know this. Students here and across the state have not been in a classroom face-to-face with their teachers and their friends since March.
Yeah, many turning to online learning during Governor Lee's safer-at-home order. Others, though, getting creative with homemade lesson plans. And with these unplanned changes and extended periods of isolation, many families are having more conversations about mental health.
WATE 6 on your side's Madison Keevy now introduces us to a Knoxville family making wellness check-ins a priority.
When the weather's nice, the Napper kids are outside a lot lately. It's part of a new normal for this Knoxville family. Woo! With school and sports canceled since March because of COVID-19, adjusting wasn't always easy.
There was more fear in the beginning than anything else. And we've always tried to be pretty open with our kids and answer their questions and give them the opportunity to ask questions.
For the first 2 months, Christy Napper created a daily lesson plan to maintain normalcy.
We would start school around 9, and every kid had kind of a focus for 30 minutes.
The at-home school day even had PE. And with both parents working from home, Christy says moments like this helped them stay in tune with how their kids were feeling.
Some days are just really hard, and that's okay. But I think one thing that we do with our kids is we try to tell them we don't have all the answers.
Braden's going into kindergarten, Cameron into 4th grade, and the oldest, Joel, going into 5th grade. Christy says each has handled these changes to their year differently.
It's okay to be scared. It's okay to have questions. It's okay, to have all the different feelings that you're having.
It's just a simple question. What do you think is going on in the world right now? What's your understanding?
That advice from a Covenant Health psychiatrist who says parents, like the Nappers, are doing the right thing by asking their young ones open-ended questions.
We have to give them a language for when they start to feel sad or nervous or irritable or not sleeping, or maybe they might regress and start, people who have been potty trained might start wetting the bed again. And we have to give them comfort about how to talk about these things and why they're having these kinds of discomforts.
The impacts of these changes to daily life won't end when the school year starts. But today, those worries are in the distance. These two are ready to be back on a real baseball field. Reporting in Knoxville, Madison Keevy.
Oh, such important info there. And our psychiatrist in the story adds that conversations about social distancing, wearing masks, and changes to the school day will be different depending on a child's age. So he recommends parents find language that works for their child to help them best understand what's going on and express their feelings. Keep it age appropriate.
There you go. Lots of things to think about. Hey, still